all the kidney warriors. This is Vasundhara Raghavan from Kidney Warriors Foundation. I'm here to talk to you about a book that we have brought out on kidney disease. It's called The Nutritional Secrets. It's for all kidney patients in the CKD stage, that is the maintenance stage, people who are on dialysis, hemodialysis and peritoneal dialysis, and people who had a transplant. Why is diet so important? This is a question that always came to my mind. When we go to the doctor and he tells us that the kidney has failed, he will talk to us about three things. He'll talk about the treatment that he can offer. He'll talk about the medicines that we need. And he'll also tell us that, listen, you have to manage your diet. You need some restrictions. So the doctor can give you the best treatment and you can have a good life on kidney disease only if you manage your medications, your treatments, and your diet. All three are important, and it cannot be that only the treatment is there and no medicines are taken or no restriction on diet. So all the three elements go in to make your kidney disease journey a very happy one. The book tells you about how much to eat, whether it is carbohydrates, protein, sodium, fluid, fats, or fiber, and why should you eat it. Also, it tells you what is it that you can have. So you need how much to eat, you need why to eat, and what to eat. Ideally, this is the best thing to do, eat less. But at every stage, you'll need different amounts of protein and fluids. It'll all depend on the blood levels, and we must maintain our blood levels within the normal range. So in order to maintain the blood levels at a normal range, we need to have also a diet and medicines, everything to be in place. Why do we need to manage blood levels? So that we can avoid a cardiac issue, we can avoid bone damage, malnutrition, and many other complications. So this book will help you. Watch our videos, read the tips that are given in the books and in the video. It'll guide you. It'll tell you or alert you saying, always check urine output. Check potassium in foods. Learn to limit and enjoy. Please avoid sodium-rich food. In all this, who will help you is the next question we have. You need to get your support from your nephrologist. Ask all details on what is restricted in your case, because it is restricted for each patient, but in different things. Like some people have a sodium restriction, someone has a water restriction. So you need to talk to your nephrologist. Then you meet a renal dietitian. Explain your case properly. What is the restriction the doctor has suggested? Sit and plan your meal, because you need to be happy with the meal that is advised to you. Okay, you have restrictions, but yes, may I have this because I love this, is what you have to tell your dietitian. So the dietitian can plan for you. He or she can tell you that, listen, you can have this particular thing that you like once in 3 weeks. Or on the day when you have this, see that you have no high potassium food. So these are the tips that are very important. And gradually you will learn how to manage your diet. It will take some time. Like no one is an expert in this. The dietitians also learned this while treating the patients. So they have an experience from that. So you need to rely on the dietitian, get the diet advice and try and follow it as much as possible. It depends on you how well you take care of your health. Watch all the videos that are coming out from Kidney Warriors Foundation on the diet, because we've taken a lot of trouble to make it available for you. Read the book, because it's got very good tips and guidelines. and we want you to live happy and long with kidney disease. Why is nutritional secret so important? Why am I saying that? Read this book. It is designed by kidney patients who have experienced it, who have seen the restrictions, who realize that, okay, this was where I made a mistake, and I now, it's too late for me to correct it. But well, I leave a book and a message for other patients so they can manage their kidney health better. The information is given by dietitians who are practicing with renal patients, and they know exactly what is good for you. The nutrition information is coming out from India's research. India has done a research with all the produce, the vegetables, fruits, and grains that are produced in India. So we have, for the first time, a total database of nutrition information, which is based on Indian soil conditions, Indian water conditions, the environment in India, and vegetables and fruits are selected from across the country, brought into a pool, and then randomly selected for this research. So it is not that something is grown in Maharashtra alone is good for Punjab. What is grown in Bengal is good for Tamil Nadu. So we have all the vegetables put into one basket, and the researchers have taken a sample out of it. So it's a very well done research, well thought through research, and that's why we've used this research for this book. I again like to tell you that this is the best renal diet advice you will get. Not because I'm saying it, but I'm saying it from the perspective of kidney patients who have looked at the book, and you will know more about it from our promotional video where we talk about many people who have experienced, who have read the book. So the promotional video will come from Anjali Uttup, and she will be talking about what the doctor said, what some dietitian has said, what a patient has experienced. So all this will make it the best advice that you can get. And please be happy with your renal diet and learn to manage it, because there is no way of escaping from this. Thank you so much for listening through to my video, and we hope to have your continued attention to your diet. Thank you.